So today I'm going to tell something about the PPIs and how do they cause or how do they affect the kidneys. PPIs, as all of us are aware, as doctors, that proton pump inhibitors are short formed as PPIs, and this is one of the most commonly used medication in the world. And least realizing that this medicine could be quietly destroying the kidneys and as a nephrologist, if we see the patients and go into the details of their history, many of these patients will often tell you that yes, they have been taking the PPIs, and in some of them for probably months or even years. So, what are the PPIs? They are the drugs used to reduce the quantity of acid produced in our stomach. And all of us must have heard these names like omeprazole, pantoprazole, and esomeprazole, etc. And these are the drugs which are freely and very commonly prescribed for conditions like gastroesophageal reflux disease, dyspepsia, and certain esophageal conditions like Barrett's esophagus. But the worrisome feature is that they are taken very casually, even for years, as over-the-counter drugs. As the by and large, the people consider these drugs very harmless, but actually they are not. So let us see what are the ways in which these PPIs can damage the kidneys. So they can damage the kidneys on an acute basis. That means even with the short-term intake, they can damage the kidneys on a long-term basis. That means you continue the intake of PPIs for a long duration and they can damage your kidneys. Coming to the acute condition, that is acute tubular interstitial nephritis, where within hours to perhaps days of intake of PPIs, the kidneys get affected. In fact, to be specific, the tubules, which is a part of the kidney, get affected with this injury, and various cells are deposited over there, which should actually not be there, and they gradually give rise to a progressive renal scarring or kidney damage. And what makes it further dangerous is that they are absolutely symptomless, and in a very few patients may probably present with some low-grade fever and probably just a vague malaise kind of a thing. And there are no other symptoms, and many of these patients, almost 30 to 70%, they never recover fully and gradually proceed into what is called chronic kidney disease or a chronic kidney damage. And some of them eventually end up requiring dialysis or even transplant. Now, second, which is kidneys getting affected with a prolonged intake of PPIs, that condition is called CKD or chronic kidney disease. As I said, that least realizing that these drugs are not actually harmless, we continue taking this as a self-medication and consider it very essential for our day-to-day symptoms of of acidity, and we continue this. So, what does the medical literature say about the same after having described the ways in which it can damage the kidney? There have been various studies, but some of them stand out, giving the numbers, alarming numbers, that if we compare the intake of PPIs with those of the intake with H2 blockers, which are also used for the same condition, that means to reduce the acid production in our stomach, the risk for acute kidney injury goes up by almost 50%, or to be precise, 44%. And the risk for CKD or chronic kidney disease goes up by almost 1/3 or 36%. And one of these studies where a very large chunk of patients amounting to 1,70,000, that's a study, it was proven that the risk for having end-stage kidney disease, when it was compared with the H2 blocker users, there was a quantum jump by almost 50%. The risk was higher by almost 50%. So, what should we learn from this brief discussion which I had with you, or interaction which I had with you? is that always review whether the PPIs are actually indicated or not, and whether they are indicated for long term. And wherever they are indicated, they should be given for the shortest duration possible under the strict vigilance or guidance of the gastroenterologist and in many of the cases the nephrologist. And especially in the patients already having a kidney injury, be it in the form of acute kidney injury or chronic kidney disease, there should be a deliberate and justified choice for the regular monitoring of the kidney functions. And if any of the kidney damage, be it in the form of acute tubular interstitial nephritis or chronic kidney disease, they should be stopped immediately. And if there is still happens to be indication for antacids to continue, then immediately, wherever possible, the patient should be switched over to H2 blockers. So, just to reiterate the point that the PPIs are not harmless, and ultimately, if you continue taking them as harmless drugs, the kidneys pay the price.